Hey Super Mamas, it's Dr. Joy here and you are watching Delivering Joy MD TV. Welcome to Super Mama Sunday, where we have been talking about taking back birth. Yes, that's right, taking back birth. I am in process of telling you about the 5 tips that I have for how to make your birth your own. So today I'm on tip number 2, and I am talking to you about choosing a provider. Yes, choosing an OB care provider is a really important decision. So make sure you keep watching to get my tips. All right, Super Mamas. So let's talk about choosing an OB care provider. I think this is a really important thing, and I feel like maybe sometimes people don't think this through all the way. This is a relationship, and I think it's a very important one if you want my opinion, which, I feel like if you're watching, you probably do. So I feel like, when you're getting ready to go through your pregnancy and your birth and your postpartum period, this is someone that you're literally trusting with your life. So, I see people all the time that when they're getting ready to, put color in their hair or get their photos done, they're so serious about choosing who's going to do their hair or do their makeup or do their maternity photos or plan their baby shower. But when it comes to who is really going to take care of their life and their baby's life, they really don't do a whole lot of research. Don't do that. Make sure that you are paying attention to who it is who's going to be taking care of you throughout your pregnancy, your birth, and your postpartum period. Do your homework, do your research, read up on these folks. Make sure that they are board certified, that they completed their training. These are important things. We ask everybody we know when we're looking for the bomb hairstylist or who's taking the best photos. We're looking at their pages. We want to know all about them. If we want them to plan our wedding or our baby shower, we're really asking around, getting word of mouth, finding out about them, reading about them online, or finding out about how many stars they have, reading every possible review. So the same thing needs to be true about your OB care provider. Now, can you sometimes go wrong with reviews and comments? Sure, absolutely. I'm sure there's a few 1-star, I hate her comments out there running around about me. But at the end of the day, your numbers, ratings, and reviews don't lie. So, the majority of those comments should be positive. The majority of people should have positive things to say about them. There's actually what's called the National Provider Database. And the National Provider Database is available online. And anytime that a doctor is sued or disciplinary action gets taken against a doctor in the United States, it has to be reported to the National Provider Databank. So that's a place to check to see. And anytime a hospital hires a doctor, that databank has to be checked. So that's a place to check. So if you're not just depending on Google and you want to see some real hard facts, that's a place to look and check. But really, honestly, the women that you trust, the women that you look up to as mentors, the women in your community who have had great experiences, those are also really good experts to tap into when you're thinking about who you want to care for you during your birth and your postpartum period and throughout your prenatal period. Now, I hear mixed reviews about this in some of my OB care provider groups that I'm a part of. I'm a part of birth keepers and, OB groups and birth workers groups. And I sometimes hear people complain about folks who want to interview them before they choose them as a birth care provider. But for me, I think it's great. I think that this is such an important part of your life. It's such a momentous event in your life that I would want to interview someone who's going to take care of me if I were to become pregnant and birth and have a baby. So I would want to interview them. I would want to know about them. I would want to ask them questions. I would want to talk about what my goals were and find out if they were the person that I would want to work with, to make sure that I was safe and healthy throughout my pregnancy and birth and postpartum period. So I think that's actually a good thing. So I personally welcome when people want to interview. We can set up a video visit or a phone consultation. Now, understand this, that no one's going to spend an hour of their time with you for free. So you should book an appointment with the person that you expect to interview. And so that can be a virtual visit, it could be an in-person visit, or it could be a phone visit, but expect to give your insurance information or to pay your fee and to sit down and talk with this individual. Because, you should not expect for someone to explore this with you or to have the benefit of someone's expertise in their time without compensating them. So you don't do your job for free. You shouldn't expect them to do their job for free. In your search for OB care, keep in mind that you're not just dealing with that OB physician or nurse midwife or other midwife, you are dealing with their office staff, you're dealing with that hospital. So think about those things as well, particularly when it comes to their office staff. Are they friendly? Are they engaging? Are they inviting? Because you're gonna have to go through that office staff to get to that provider. So if you're having a problem, a complaint, you need help with something, you're gonna need to deal with that office staff. So you want to kind of get the feel of that location where you're going. And one thing I have to say about my office staff is that they are phenomenal when it comes to taking care of the people that come in here. So you want to find a whole team of folks who you feel have your best interest at heart and that they are really going to take care of you and your family. So think about that. You also want to consider the delivery options that you have when you are dealing with that provider. So if your OB or your midwife goes to a variety of hospitals or delivery locations, then you want to consider all of those. If you're planning to deliver outside of a hospital, like a birthing center or at home, you want to consider all of your delivery options, where those are, and what are the safety measures that are available to you at those various delivery sites. So now we have what are called AIM bundles, and AIM stands for the Alliance for Innovation for Maternal Health Outcomes. So when we're talking about AIM bundles or safety bundles, these are things that should make it much more efficient and effective to care for moms who get into OB emergencies. These are things like postpartum hemorrhage or hypertensive emergencies, where moms have really, really high blood pressures and are at risk for having seizures, or maybe they're already having seizures, or other problems that occur when blood pressures get extremely high. So these safety bundles have been put together so that birthing facilities have carts that have everything that they need on them so that we can respond quickly and effectively to like postpartum hemorrhage. So they would have everything they need, like extra IV tubing, all the medications that we would need to treat a hemorrhage, extra packing if we need to pack the vagina, or sutures to close wounds that might have been sustained during a delivery. They have tubes to draw labs. They have whatever you could potentially need to take care of that mom in that moment. Having everything right there on hand has really helped decrease what we call severe morbidity or even mortality. So morbidity can mean when moms are really sick, so sick that they almost died. And then of course, mortality means that they actually did die. So asking about these things at the birthing facilities that you may deliver at are very important. Asking kind of what safety measures are you guys putting in place to make sure that I'm going to be safe when I come up in here to have my baby. A great resource for looking at hospital safety is leapfrog.com. Hospitals report their safety outcomes here and are given a score like A, B, C, D, E, or even F. Think about what sort of experience you want to have. You can choose a physician like a OBGYN, or you can choose a midwife. And there are a couple of different types of midwives. Some folks choose a nurse midwife, a certified nurse midwife, or a certified professional midwife. And certified professional midwives generally are going to be delivering outside of the hospital, whereas certified nurse midwives generally deliver in the hospital, or they may deliver at other sites like at birthing centers or at homes. You want to have some real frank conversations about your risk level when you're deciding what sort of provider you want to choose. I think that every woman should have the autonomy or the choice to choose what sort of birth that she wants. But I think you also have to be responsible for the choice that you make, right? So if I'm super high risk and I choose to have my baby at home, well, then I may not have the benefit of having the things that I could have had at the hospital. So if something happens to me, then I'd have to own that I made the choice to have my baby at home, right? So I can't then get mad at the person who attended my home birth because something happened to me. So when you make choices and you have true autonomy, or you have true power over your choices, then you got to own the choice that you made. We have to accept the responsibility for the power to make our own choices. And we have to also accept the outcomes of our choices. So it's very important to have a really true, clear understanding. Remember last week we talked about how you need knowledge in order to have power to make good decisions. So having the knowledge about your overall health and well-being is very important before you make these choices. People who need a higher level of care may want something that may not necessarily match up with the level of care they need. And I say that because, say for instance, if I want I want to have a home water birth, but I have hypertension and diabetes that are completely uncontrolled, and I've had 3 prior cesarean deliveries, and I have other health problems, that might not necessarily be the best thing for me. Now, I can still choose to do that, but if something happens to me and I'm at home in my tub, it may take a while for help to get to me, for help to then get me back to the hospital, and for someone to be there to intervene to save my life. Does that make sense, y'all? I hope I'm making sense here. So while I have the power to make that choice to stay home in my bathtub and have a baby, it might not be the best choice for me. But if that's what I choose, then I have to accept what my outcomes will be. And I also have to, really think about the choice that I'm making. Is this the best choice for me and for my family and for the other people who depend on me, like my other 3 children that I've had by C-section previously? If I've never had a vaginal birth, would it really be a good idea for me to start now at home in my tub, even though I have other medical conditions that, make me a higher risk birth? So you have to really start to think about these things and process them and learn as much as you can about them so that you have the knowledge, and then you can take power and have the autonomy to make the choices that are best for you and for your family. So you want to consider those things. If you are a higher risk pregnancy and higher risk birth, you may want to consider choosing an OBGYN physician as a care provider. If you don't have medical problems and you haven't had a lot of complications in the past with your pregnancies, or if this is your first pregnancy and you don't have a lot of medical complications and you really want more of a natural pregnancy and birth, then a midwife may be a good choice for you. If you want more of a holistic approach for birth, if you are thinking that you don't want a highly medicated birth, or you want a completely unmedicated birth, and you want something that's outside of a hospital, then a midwife may also be a good choice for you. So these are things that you want to start thinking about, researching, reading about, and you want to explore all of your options. So, consider all of these things. It is so important to educate yourself. Educate yourself. That's what this channel is all about, to give you education to make good choices. And, when I talk to mamas about making good choices, it starts very early on, before you even become pregnant. Making good choices to take good care of yourself, to eat well, to exercise, to maintain a healthy weight, to make sure that you're getting annual physicals and keeping track of how you're doing in terms of your cholesterol screening and your liver and kidney function and your diabetes screening. And so these are things that help you have low risk pregnancies and low risk deliveries. But if you're not taking good care of yourself on the front end before you even get pregnant, then the likelihood of you having a higher risk pregnancy and a higher risk birth is much higher. And so that means that when it comes time to become pregnant, to birth, and to have, your postpartum period, then you may be at higher risks. And that's why more interventions can become necessary. So you want to think about this from a holistic approach. The better you take care of yourself before you get pregnant, the better your pregnancy will be, the better your birth will be, the better your postpartum period will be. So think about choosing your provider or your OB care just like you would choosing a partner, because that's literally what it is. It's who's gonna walk through this super important time in your life with you. Now, I know I'm gonna get some smoke in the comments about this, but I wanna speak one-on-one to my providers, real talk out there. If you're an OBGYN, if you're a midwife, if you work with pregnant folks in whatever capacity, some of the things I hear, some of the things I see are just so uncalled for, y'all. And I'm not just talking to you, I'm talking to myself. We seem to have a lack of empathy sometimes. And believe me, just today, I came into work. My head was hurting, I'm tired, I got a lot of stuff going on in my personal life, but y'all, we have to fix whatever is broken in our empathy for these moms and these birthing folks that we're taking care of. There's no need for whatever's happening in our lives to affect what's happening in their lives. Even though we do this every day, they don't. People don't have babies every day. People don't become pregnant every day. People don't expand their families every day. And so I think that sometimes the attitude is very cavalier that we have when they have issues, when they're going through things, when they have complaints. We can do better than what we're doing. I see so many people all the time that talk about how they didn't feel heard, how they didn't feel listened to, how they were dismissed. And yeah, sometimes they just want to talk about their back hurting or their pelvic pain or pressure. And yeah, they are just moaning and complaining. But the whole point of it is that we're supposed to care. We are supposed to care. That's our job, is to care. So sometimes just saying, validating them. Yeah, I know it hurts. I know it does. Pregnancy is so uncomfortable, isn't it? It's all they really need is for somebody to validate them. Give them some tips on what they can do with that round ligament pain, what they can do to try to help it. So don't be dismissive of people. Don't be cavalier about their process and their birth. We don't know what they are going through outside of our four walls when they come in to see us in the office or in the hospital. A lot of these folks are catching hell, And when they come to us, they need to know that at least one person, one set of people care about them. Today, right before I came in here to film this, a young lady said to me, she said, I was going through so much in my personal life. I was going through, intimate partner violence. Things were happening in my household that were just crazy. She said, but when I came up in here, I knew somebody cared about me. She said, y'all helped me protect my peace. And, I wasn't feeling good. I already told you I wasn't feeling good. I really was over the day before it even got started. But this morning, hearing that and her saying, my experience was so good. The way y'all treated me, everything was just perfect. It was beautiful. I felt like my pregnancy and my birth was beautiful. Y'all, that did something to me. It did something for me, because we really do work hard in this office to make everybody feel like they matter. And so I just want to say to you, because I know that this job is hard. It's hard. And we have so much we have to deal with. I've been there where you feel overwhelmed and overworked and you're tired and you haven't slept all night and you still have a whole office full of people to see. And you got things going on with your family, and you got administrators breathing down your neck telling you, see more patients, do more surgery, do more. I know how it is. But we cannot give up on our patients. We cannot give up on what we said we wanted to do. Nobody forced you to go to medical school. Nobody forced you to go into OB/GYN or midwifery. No, we asked to do it. Not only did we ask, we begged to do it. We're excited to do it. Used to love to do it. So my challenge to you, should you choose to accept it, is to remember when you loved this specialty, to remember when you had a burning passion for medicine, when you loved OB/GYN, when you were the first one to that delivery room because you were so excited. Remember that. Remember when you loved meeting a new patient. Remember when you loved going to see the baby that you had just been part of their birth. Remember that. And the next person that you see who is pregnant or who is birthing, remember what an honor it is to be trusted with that special moment. I hope you enjoyed this video today. I hope you find the right provider relationship for you. And I hope you'll subscribe here and turn on your notifications so that you don't miss a single Supermama Sunday episode. I'll catch you next Sunday, Supermamas. Peace.